Now to a 7 on your side story we first told you about in February about a Newark urgent care accused of charging patients for COVID tests it advertised as free.
A restraining order is in place preventing the business from sending out new bills. Yet, at least one patient says he recently got a call threatening to take him to collections.
ABC 7 News investigative reporter Melanie Woodrow is here with the latest developments. What's going on?
Larry and Kristen, AFC Urgent Care in Newark says this was likely a mistake. This patient shouldn't have been called or threatened to be sent to collections, but the viewer that we spoke to said he's wondering if the business isn't still trying to get money wherever it can.
During the height of the COVID-19 pandemic, patients flocked to AFC Urgent Care in Newark.
They hung a sign on their building saying free COVID tests.
But Clayton Hurst was one of several patients who later discovered the tests weren't free. He received a call from the business that he owed more than $1,000.
Well, I was very confused and just highly concerned.
Hurst had seen a report on ABC 7 News in February about AFC Urgent Care in Newark. In it, the company's owner, Dr. Parmjeet Singh, said AFC Urgent Care in Newark was billing patients because it hadn't been reimbursed by insurance companies and couldn't sue the insurance companies for the money under the CARES Act.
I should be getting rewards and awards for being a selfless person. But instead, I'm being haunted by patients who don't understand. When they needed the service at 2 o'clock in the morning, they came here and touched my feet. Sir, thank you for being open. And today the same patient say, why should we pay your bill?
In February, an Alameda County Superior Court judge issued a temporary restraining order precluding AFC Urgent Care in Newark from billing patients for pandemic COVID services.
I did mention it to the caller at the time, and he did threaten me that he was going to send me to collections.
So Hurst contacted 7 on Your Side. Ratan Dhaliwal is one of the attorneys for AFC Urgent Care in Newark.
If the call went out, obviously it's a mistake because as far as I know, Dr. Singh stopped the collections effective January 20th, and that was long before the restraining order application was filed.
It's a numbers game is what I imagine, is if they call 100 people, there's going to be a certain percentage of them that this is going to scare them, and they're going to pay whatever it is that's, that they're asking.
We are not doing any numbers game here. Nobody's playing any Mickey Mouse games here.
According to the California Health and Human Services website, California was still covering free COVID tests until November 11th, 2023, 6 months beyond the federal requirements on health plans to continue covering COVID-19 tests, vaccines, and treatment from any licensed provider in or out of network with no prior authorization or enrollee cost sharing.
The threat of going to collections have been substantial enough for you that you would have paid the bill?
It's very likely. I have a very good credit standing. I'm a very busy guy, so having to overcome a false collections claim, a lot of times it's not worth my time. It would be easier for me to make that payment so I don't have to deal with it.
I asked AFC's attorney who he believes is responsible for reimbursing for these COVID tests.
Right now, way I'm reading it, nobody. Dr. Singh got shafted.
Then why are patients getting bills and getting phone calls?
Since I came onto the picture, we stopped it, man. If somebody got it, that's a mistake.
Travado Medical Group, which does business as AFC Urgent Care of Newark, filed for bankruptcy. The attorney for the company says that Dr. Singh may also file for bankruptcy. So for those people who already paid these bills, I think it'll be really difficult for them to get their money back.
I feel for them.
What were they charging in general?
Yeah, everybody I talked to for the last piece in this one, somewhere between the upper hundreds, maybe $1,000, and it was for the swab. It was, they had seen a doctor, but the patients told me they don't remember being evaluated by a doctor, or maybe they went on a weekend, or they went on an off hour and there was an extra charge for that. So it sounds like there might have been some extra charges, and that's why we had these bills that were somewhat inflated.
Wow, and that money's gone.
For the people who paid, I think it may be difficult for them to get their money back.
All right.